Module 5, the objective examination, crafting and executing a discerning, optimal physical examination. From a skilled subjective examination, it is possible to predict relevant objective examination findings implicating upper cervical dysfunction. This can only be done if there's a prior knowledge of relevant objective examination findings. Therefore, Module 5, the objective examination, precedes Module 6, the subjective examination. The objective examination of the Watson headache approach is gentle and unique. Feedback over the past 25 years indicates that the objective examination is the most accurate and specific physical examination of the upper cervical segments for headache and migraine. Now, this module includes numerous videos of techniques, including 3D animations, videos of patient-therapist position, and also from a headcam to demonstrate thumb position. So techniques include cervical retraction, a really powerful tool, particularly for episodic headache. There is so much information that can be gained by performing generalised retraction and then repeating with C2 blocked. The stability tests. Reproduction of cardinal signs of cord compression are not necessary to confirm instability. The tests used minimise impact on potentially damaged structures and can be done quickly, safely and effectively. Assessment and correction of C2 position, battle 1 or B1, is critical. Following a simple 3-step palpation and clinical reasoning process, C2 position can be easily established. Forget palpating the laminae. I found that really hard. I will show you a much easier way of going about assessing the position of C2. And then, using gentle, sustained thumb pressures, 7 techniques to determine which segments are referring to the head. This is battle 2, B2. The palpation clinical reasoning process involved in each technique ensures there is no guesswork. The exact referring segment can be readily identified. The diagnostic accuracy of the Watson headache approach, the objective examination, underpins successful management. Reproduction and resolution of typical headache when stressing individual upper cervical segments is a fundamental and founding early 90s tenet of the Watson headache approach. In 2014, the results of a seminal study were published in which reproduction and resolution of typical head pain in migraineurs resulted in desensitisation of the sensitised trigeminocervical complex, which is the underlying disorder in migraine and other forms of primary headache. In essence, this confirms a cervical peripheral driver for central sensitisation in migraine, that is, relevancy of noxious C1 to C3 afferents. This is the first time a manual cervical intervention has been shown to positively affect the core of the migraine process. So the aims of Module 5: to advance your knowledge of retraction as an assessment technique, to perform stability tests asymptomatically with confidence, safety and effectively. Introduce a novel 3-step palpation clinical reasoning process to confidently establish C2 position, and then to be able to confidently identify the referring segments of head pain.